All right, guys, and welcome back. We just discussed about lithium. Now let's see what's in store for valproic acid. It's an important medication you need to know for your PMHNP board certification. This is our roadmap. We are currently on training 11, valproic acid. Okay, so here you need to really know all medications that have a black box warning. If lithium is excreted by the kidney, valproic acid, on the other hand, is excreted by the liver. It it has a black box warning for hypotoxicity and pancreatitis. Hypo, hypo, Hypotoxicity and pancreatitis. So you need to be aware of that. It can cause birth defect to include spina bifida, mostly important, but also cleft palate. So now let me give you an example. So you need to monitor liver function tests, the LFTs, regularly to detect hepatic abnormalities, difficulties with the liver dealing with this medication. How do you remember? Valium, value your liver, or val for valproic acid, right? So value your liver, more effective than lithium for rapid cycling in mixed bipolar. Okay, more of a practice, a guideline here. For example, if can be preferred the choice for patients that experience multiple mood episodes within a short period of time. Mnemonic for that will be rapid value, right? For the rapid cycle, and VAL for valproic acid. High therapeutic index compared to lithium, which was zero point 0.6 to 1.2. Valproic acid now is 50 to 125. High therapeutic index. Example here is check serum levels to ensure the patient are within the therapeutic range. Mnemonic 50 to 125 keeps you alive. Okay. Now, again, it can cause fetal defect, okay, especially if it during the first trimester if the mother took valproic acid. So, which ones? Neurotube defect, which is the spina bifida. Mnemonic for the VPA closed the case, but not the neurotube. So the VPA of the heart they closed, but not. I mean, the VPA closed the case, but not the neurotube. Right. So the neurotube is open, and that means the spina bifida. It can cause cleft lip or cleft palate, which is VPA opens up the smile in the wrong way. Don't mean to make funny of anyone, it's just a way of memorizing. And they can cause cognitive impairment as VPA IQ drop. Remember to remember to counsel your patients, um, a female of a patients of childbearing potentials about the alternatives, medications, or effective birth control options if valproic acid is the medication of choice. Now, checking on learning during pregnancy, if a patient takes valproic acid, right, Depakote, the following condition would be a concern regarding the baby. Would you be concerned with A, Steven Johnson syndrome, B, Epstein abnormality, C, spina bifida, or D, Down syndrome? Well, if you answer spina bifida, you got it correct. Taking valproic acid during the pregnancy is associated with an increased risk of a neurotube defect, including spina bifida. Now, just as a review, which drug is associated with abstinence abnormality? If you said lithium, you are correct. Which condition is associated with Steven Johnson syndrome in general, not birth defect? Well, Steven Johnson syndrome it's associated with what, guys? Carbamazepine and lamotrigine. Which drug is associated with the cleft palate? Benzodiazepines and also valproic acid. And just like that, we concluded module 11, module 1, training 11. Let's move on to the next training level.